Everyone, once again welcome to my Oet channel. So today's video it's related to one role play. So this is happens in community health center. You are talking to a 2-year-old girl's parent. So this role play it is related to the surgery of insertion of grommets in both ears. So in this case, a role play, first thing you have to know that it is a second degree talk. You are talking to parent, so more reassurance is enough. I mean, more reassurance are needed, and here you have to give equal importance for parents' concerns. That means you should not give all relevant details like one by one. You have to explain one, then you have to answer. Do you have any concern? You can explain another one, then you can ask them. So it should not be repeatedly, but you have to include or involve parent as well. So we will go to the settings. So this is community health center, and your role is you see the parent of a 2-year-old girl who is going to have surgery next week to insert grommets in both ears. So this grommets means it is nothing but it is a surgical insertion of one tube into the ears to remove the fluids. That means if for someone who have continuous or recurrent otitis media, so this is the management. They will insert the tube and they will remove the fluid. So this is the surgical procedure. So the parent has received a letter regarding the surgery date and pre-admission instructions. He or she has some concerns about the fasting requirements and the child is not present. So actually the surgery is scheduled for next week, and the parent came to hospital to get some information regarding the surgery and especially regarding the fasting requirements. So child is not present, just you are talking to the parent. Anyway, we will start. The first task is find out reason for patient's visit. So just we can start like this. Good morning, my name is Rashmi Rajan, one of the registered nurses working in this community health center. How may I address you and how can I help you today? Then parent is telling that, good morning sister, my name is Wilson, and I came here to get some information regarding my baby's upcoming operation. Then the next task is that emphasize importance of fasting. If they have given the importance like cough and gag reflexes lessened with anesthesia, risk of vomiting and aspiration of food and liquids from stomach, operation rescheduled if not fasting. Then remind parent of fasting requirements like stopping food or milk products 6 hours before operation, stopping clear liquids 2 hours before continuing oral medication. So here it's according to the interlocutor. Sometimes the interlocutor may explain you regarding the surgery. Sometimes they will not give, as what I told you, only this much information. So we have to get some more information regarding the scheduled surgery. So we can ask like this. For our better communication, could you please tell me exactly, so what is the surgery your baby is scheduled for? Then parent is telling that a sister actually she is scheduled for insertion of grommets in both ears. Then we can tell that okay, fine, Mr. Wilson, no need to worry, I will explain you in detail. So actually your baby's doctor has instructed for her fasting before the surgery, isn't it? So actually I will explain you the reason behind of this procedure, because the coughing and gag reflexes will be lessened with anesthesia. Moreover, the risk of vomiting and aspiration of food and liquids from stomach also can be achieved by this fasting process. And I would like to remind you that if your baby is not fasting at that time, there is a greater chance for rescheduling your daughter's operation. So I'm strongly recommending you to make her fasting in this particular time period. That means the which is mentioned in the instruction paper. Then the next one is we have to remind regarding the fasting requirements. So as information we can tell that for your further information, Mr. Wilson, I would like to tell you the fasting requirements, such as please try to stop the food or milk products 6 hours before the operation, and it is essential for your baby to stop even clear liquids 2 hours before, but you can continue the oral medications with a little water. So Are you okay with that, or are you getting my point, or is it clear for you? Like that we can ask. Then the next one is remind parent of option of clear liquid. So here there will be a possible question from parent side. Sister, actually I got a point, but I don't know what is that clear liquid. Then we can tell that, okay, Mr. Wilson, I can tell you regarding the clear liquid. You can give apple juice but not orange juice until 2 hours before the surgery. But after that time, please try to stop even this apple juice also. So are you getting my point? Like that we can ask. Then the next task is reassure parent about child's hydration, like IV intravenous fluids administered during and post operation. Find out what parent has told about child about operation. Okay, so here possibly parent will have the question that without these food and fluids for a long time, how she will tolerate. So that is the possible question. Like, sister, I'm so much worried that without this fluid, how my baby will tolerate. So we can tell that, Mr. Wilson, I can really understand your concern. Being a parent, it will be a difficult situation to undergo, but no need to worry. During admission, we will start intravenous fluid administration for your baby through the intravenous line. So continuously she will get these fluids, so no need to worry about the dehydration even after operation. Until when she will regain her normal dietary pattern, she will be on hydration therapy. So nothing is there to be worried about her hydration. So are you okay with that? Like that we can ask. Then the next question is find out what parent has told child about operation. That is our question. You can ask. I would like to ask you one thing. Have you told anything regarding operation to your baby? The parent is telling that no, sister, actually I don't have clear idea about the operation, so we didn't inform anything to her. Then we can tell that. So it is advisable for you to actually, they have given advice parent to describe operation to the child in a simple manner because baby is 2 years old. So we can just like a simple way, they can inform that cream applied to back of both hands and there will be a sharp scratch, then she will go to deep sleep. So like that. So this is like a storytelling only. So how we can tell, okay, Wilson, so in this age group, this surgery will be overwhelming for her. So you can just describe the operation, like you can tell that inside the operation room they will apply cream to back of her both hands and there will be a sharp scratch. She will go to sleep, she can have dreams, something like that, and after operation she will be perfectly all right. Like that's like a simple story way she can get the information. Then we can recommend parent explains benefits to child also, like after the surgery better hearing and fewer infection because otitis medium is recurrent, it is she's getting recurrent otitis media, so that only she's undergoing the surgery, so that she can add that one also. So we can tell that, Mr. Wilson, you can add this point also to your baby so that she will be happy after operation, she will have better hearing and in future she will not get infection also. So I hope your baby will be happy if she hear about this news. Then mother is or parent is telling that, yes, sister, I hope so. I will explain what you told me. Then we can tell that I'm happy to know that you are accepting my advices. Then the next task is explain requirements for child's discharge. Example, full recovery from anesthetic, tolerating clear liquid or light food, passing urine, etc. Then find out any other question. So we can ask that, Wilson, Mr. Wilson, do you have any other concern? Then parent is telling that, yes, actually I would like to ask you regarding the discharge process. You can tell that, yes, it is a reasonable question. I will explain you. After surgery, when she will recover from anesthesia and tolerate with the clear liquids or light food, as well as when she pass urine, so she will be completely all right. After doctor's consultation, without any delay she can get the discharge. So have you got it? Like that we can ask. Then parent is telling that, okay, thank you for information. Then we can ask once again, do you have any more concerns to get clarification for your baby's operation? Then parent is telling that, no, I don't have any other questions, thank you for your all advices and informations. Then we can conclude, okay, Wilson, I hope I have clarified all your doubts. If you don't have any other questions, You can just explain all these points to your baby in a simple manner, like a story wise. And meanwhile, if you have any questions, please do not hesitate to contact with us. I will give you the contact number for you. We will see you on operation day. So thank you for your visit. Have a nice day. So with that, we can conclude the conversation. So this is a peculiar type of conversation, because in between we will get confusion. In that point, they have written, find out what parent has told child about operation. So if you didn't read that sentence, you will get confusion for the next task. You will get confusion. What is the written? Cream applied to back of both hand, or sharp scratch, something like that. So this is nothing but in a simple manner how we can explain regarding the operation to your baby. So that is only the thing. Other than that, everything it is like a straight questions only. But take care, you are talking to parent, not to the patient. So always you have to keep it in your mind. So I hope it is clear for you, and we will meet with another one informative video. Until then, bye. Take care.